Much like the rest of the body, the face also suffers predictable changes after weight gain and then significant weight loss. There are a number of things available to help us deal with these. And obviously, the menu of those is much too large to talk about here, which is why I prefer to see my patients in consult before we give a really definitive plan. But I wanted to bring up just a couple things that I think are important when thinking about these situations. Number one is selective and strategic volume replenishment. Most of the time, when we lose weight, we start to see significant nasolabial folds. We start to see early jowling, blunting of the jawline definition, a heavy neck with loose skin, all these things that you may be familiar with already. Moreover, we also see some fat loss in areas like underneath the eyes, in the temples, and the cheeks. We want to put some volume back in there. My preferred way of doing that is fat. We can also use some filler, except underneath the eyes. And the reason why that's important is because fat loss in those areas is traditionally associated with aging. And so it gives us a prematurely aged appearance. So we want to correct that. And that's an easy thing to do. Number two is what's really important to understand in a massive weight loss population is that the skin is no longer what it once was. And so we cannot rely on it anymore to give us a significant amount of improvement. That it becomes really important when we start thinking about facelifts and neck lifts, because it really makes it absolutely critical that all of the work is done in the deep plane, moving the deeper tissues, and then the skin just drapes over it. Because again, if we just pull on the skin, it's just going to relax. It's too thin, it's already been through too much, and it's just not going to work. My preferred technique for patients that have had weight loss or not is the extended deep plane technique, because I think it produces just the most natural and elegant result while still giving a very sculpted jawline and a natural appearance to the face. And in this particular situation, it becomes even more critical that we do something like that because it allows us to put all of the work on the deeper tissues, which have not been as affected by weight loss. And so we're able to get a facelift and neck lift result that is both natural as well as long lasting and effective. So you get a lot of bang for the buck with these types of techniques because again, we're not asking the skin to do anything in this situation. Those are the most important things to keep in mind. Obviously, look through the rest of the material that's available here on the rest of the website for facial rejuvenation. And ultimately, for these types of areas, I do like to talk to my patients at length in person or via Zoom, just because I think the face is so important that I don't want to have a cookie cutter approach for anybody, right? Because everybody's face is different. So everybody's surgical plan for the face should be different. It just makes sense, right?